am more than breast cancer.
I am more than gastric cancer.
I am more than Hodgkin's lymphoma stage 3.
I am more than Lynch syndrome.
I am more than metastatic male breast cancer.
I'm more than PMDD.
I am more than diabetes.
I am more than lupus.
I am more than FAP.
Welcome to More Than a Diagnosis. I'm Den.
And I'm Jess. This podcast is about so much more than cancer, chronic illness, or the labels we've been given. It's about reclaiming our lives, finding community, and thriving in ways we never thought possible.
Whether you're a patient, a caregiver, or just someone curious about what it means to live beyond a diagnosis, we're so glad you're here.
Have you ever had one of those moments as a patient where you step out from an appointment and then you're trying to kind of put everything together and you have this moment where you're thinking, why am I, as the patient, the one who's trying to put all of these pieces together? And then you remember, oh, right, because I've lived through cancer or chronic illness, and not having answers hits completely different.
Yes, and it's not you trying, to be difficult. It's you trying not to relive the trauma. And honestly, just wanting to understand your meds, your symptoms, have a plan. That's just baseline care,
Exactly. And last week I had one of those moments. And so this is still very raw and very real, but we're going to talk about it today because I was really wanting clarity, and I feel like that's not unreasonable. And I genuinely feel like that is a part of informed consent as a patient. And it's really why advocating for yourself is so important, and it's not refusing care.
It's not. And honestly, it may definitely make some doctors uncomfortable, but that's okay. You deserve care that makes sense to you. Bottom line.
Yeah, it's true. So I haven't really shared this on social media. Back in the summertime, I had an appointment with the gastroenterologist, and I'd been having some digestive issues ever since going through immunotherapy, just kind of some ongoing symptoms. So they sent me for an endoscopy, and after the endoscopy, they saw something in my stomach that they wanted to get a closer look at. So I went back and I had an endoscopic sonogram to get a closer look. And the gastroenterologist was like, well, I think that kind of looks like one of those rare genetic tumors that could turn into cancer. And I think you should have it removed. And I was like, whoa, wait a minute. Let's pump the brakes. Let's pump the brakes real quick. You think it's this thing, but we don't have a biopsy, so you can't tell me for sure that this tumor is potentially this genetic cancerous tumor. So is there a way, maybe a biopsy, that we could figure out if this thing is actually a tumor that could turn into cancer or cancer? So I went back and I requested a biopsy. Thankfully, he agreed. It was a very tricky place that this tumor is in, and it was a very long procedure that was a lot of propofol. It was a long nap that day. Long nap. But he was able to get a biopsy, and it turns out that it is not one of those rare genetic tumors that could turn into cancer, and it is some kind of benign mass that we don't exactly know why it's there or what it's doing. And so now we're going to be monitoring it. And, I'm really grateful that he did the biopsy, because now I know it's not cancer.
Yeah.
But I went in for a follow-up appointment to go over the results. I find out that it's not cancer. Great news, right? But I still have all of these ongoing symptoms that have been extremely persistent. And he can't really tell me why I'm having these symptoms. He's an hour behind, more than an hour behind with his appointments. He's very busy. I think he was in the office with me for maybe 15 minutes, and he suggests that I take this medication. Doesn't really explain to me what it's for. He asks me, well, how's your sleep? And I say, it gets interrupted because I'm in pain and I can't lay on my side. And I'm explaining all these symptoms I'm having to him. So he goes, well, if you take this medication, at least it'll help you sleep, and then that will help you start to feel better. And I'm like, okay. Okay. So a few other things happen in the appointment. That's a story for another day. But I leave the appointment without really any answers and with a script for a new medication that I know nothing about, beyond the fact that it's going to take at least 3 to 4 weeks for it to maybe start working. And that's kind of it. So I go home and I do what I always do. I look up the medication. And it turns out that this medication is a very similar type of medication that has already been prescribed to me by the rheumatologist earlier in the year that I never took, didn't feel comfortable taking, and it was just a lot. It was very frustrating, very disheartening, and I didn't really know where to go from that point. But I also didn't want to get stuck. And so I started researching what this medication was, what the purpose was, maybe why it was prescribed to me, what it could do. And I quickly realized that this medication is used to treat a certain kind of neuropathic pains. And I also learned that this medication doesn't necessarily fix the problem. It's prescribed, as far as what I understand. Obviously, this is not medical advice. I am not a medical professional. But from what I've read, it is prescribed to help reduce symptoms, not to get rid of them. In my mind, when I think about medications, I think I take ibuprofen because I have a headache, and then my headache goes away. But this doesn't work like that.
No, and your experience raises so many red flags. Where should we begin? I feel like as patients, we should always ask for an explanation.
Yes.
There's nothing wrong with asking why this, what does it do, what side effects should I expect, interactions, yada yada, and how effective will this medication be in eliminating the symptoms I'm experiencing. He should have taken the time to explain to you what the medication was and what he expected it to do. That's just...
Yes. And
I don't think you're asking for much.
The first part of those questions I knew to ask, right? I knew to ask, what are the side effects? And, how do I know when it's working? How do I know when it's not working? Something in my brain was firing, telling me that I wasn't getting all the information. And I was like, okay, what else can I ask? And I'm like trying to come up with more questions. And the one question that I feel like I didn't quite hit on the head was, what are your goals in prescribing this medication? And it's something that I am going to take with me into every appointment now. When every doctor tries to throw medication at me, is what are our goals for prescribing this medication? Because I feel like that is a huge part of informed consent, is knowing what this medication is going to do for you so that you have expectations.
Absolutely. And let me go back a little bit. A lot of times patients are told, like in your case, oh, this is benign, which sometimes translates to, oh, you're fine.
Yes.
Because you were expecting this to be malignant, to be cancer. So you're fine.
Yeah.
But you're fine doesn't mean you are not experiencing symptoms.
And that's exactly what I was telling him.
You know?
Yes.
Yeah,
That's exactly what I was telling him.
Absolutely. And the other thing we need to consider is just because we don't have answers doesn't mean there isn't something for us to find.
Yes.
And I feel like that's something, I don't know, that needs to, it doesn't automatically mean, oh, we can't figure out what you have, so you shouldn't have symptoms. You're fine.
Yes.
It doesn't work that way.
No.
And I feel like our lived experiences, this is what teaches us that this is not okay. Something in you said, wait a minute.
Yes.
Right?
Yep.
Right? You
exactly.
didn't walk away. Something in you said, wait a minute.
Mm-hmm.
I need to stop. Mm-hmm. I need to ask for an explanation, right? I feel like that's what you did.
That's exactly what I did, and still ended up having to ask more questions of the MA when he had already left to go to see his next patient. And then I had to wait for him to come out from seeing that patient to answer the questions I had asked, because I'm like, I'm not leaving until my questions are answered. Mm-hmm. And there was a part of me that felt like I was being difficult because I wasn't just being compliant. And that's where I feel that there's a shift that has happened in me, because it's not about making the doctor feel comfortable. This is my life. And if you're going to prescribe me medications, or if you're going to tell me we're going to check this thing in 6 months, I need more clarity. So I have more questions. And if that forces you to come back in the room and answer my question, I'm sorry, but I feel like that's my right as a patient. And back to what you were saying about, yes, I'm relieved that it wasn't malignant, but also, to be honest, there was like maybe 1% of me that was worried that it was cancer. I have been dealing with so many health issues for the last 2 years after finishing cancer treatments that I've been so focused on getting answers to my symptoms and what's going on with me that I feel like I don't really have a lot of time to worry about reoccurrence. Mm-hmm. You know, people ask me all the time, how do you handle the fear of recurrence? And I'm like, I don't really feel like I have time to worry about a reoccurrence.
Yeah. Yeah. And then I feel like that's also one of the reasons why persistent symptoms are alarming, and also why people with cancer and chronic illness downplay things.
Yeah.
Until it's really, really bad.
Yeah.
You know, I feel this is precisely why.
Yeah. Yeah.
Because patients are given a prescription. Take this. Oh, you can't sleep? Oh, perfect. Then take this. It'll help you.
Yeah.
It'll help you what?
Yeah.
It'll help me what?
Yes.
It'll help you sleep, he said, right?
Yes.
But you're at the gastroenterologist.
Exactly. Exactly. I'm not at the sleep doctor. I get that sleep is necessary and sleep is healing and sleep is important for our bodies, but he wasn't explaining to me in the terms of a gastroenterologist, why do you care if this medication is going to help me sleep? What are you treating? My brain was trying to process in real time to understand, while also trying to get out my questions. But sometimes it takes a minute for that information to really seep in, for then the questions to be able to come out. And I feel like a lot of times as patients, we trust our doctors. And so a lot of times people just be like, okay, well, he said to take this, so I'm going to go home and start taking this, without really knowing. And yes, he went over the side effects, because I was like, look, I'm extremely med sensitive. What are the side effects? He's like, well, I'm going to put you on the extremely low dose. And so there's not really a whole lot of symptoms when you're on the lowest dose. And I'm like, okay, that's for the general public, but I know my body, and my body tends to react in ways that maybe the general public's bodies don't react to this thing. So it was a lot in that moment to try to get everything out because they're so rushed.
Yeah.
And it's not their fault.
No, it's not. But that's, part of the problem, that they're really busy.
Yes.
And I do feel that by him not explaining all of these things to you, I feel it does a huge disservice, because then it makes you almost start wanting to second guess yourself.
Exactly that.
And then that leads to, okay, well, is this my intuition, or is this more anxiety? Because now I don't know what he's talking about. That there's so many layers to this.
Yes. And like you were saying before, it's when you have persistent symptoms and you've done all the things to try to get answers, I personally would rather have a doctor say, we're not sure, but here is what I think might be happening, and here is what I think might help. And I don't feel like that's asking for very much.
No. Oftentimes, I wonder if medical professionals don't give the full picture because they're afraid patients won't comply and won't take that medication. And so we'll tell you some of the truth, part of the truth, but not the whole truth, because we can't tell you the truth, because who's going to want to take this?
Yeah.
And I think that might have a little bit to do with it.
Yeah.
But I think...
But then that's not informed consent.
It's not. As healthcare professionals, we present the information, and that way patients can make their own decisions.
Yes. I mean, we do that with chemo. They can't possibly tell us everything that's going to happen, but they sure as hell hand out a thing that gives you a whole list of these horrible side effects that are going to happen or could happen, not necessarily going to. And I feel like sometimes these medications are like being thrown as a solution, but really it's a Band-Aid.
Oh, absolutely. It is.
And maybe some patients are okay with that, and there's no judgment on my part if that is what feels comfortable to someone else. But for myself and for my body, I need more information. I need to understand what I'm putting in my body, and I need to understand what to look out for and what to expect and why we're doing this thing. And again, I just don't feel like that's asking too much.
This goes back to healthcare professionals involving patients in their care and making the patient part of the team, instead of this relationship where I'm treating the disease.
Yeah.
It's a person.
Yes.
That has the disease. It is not a disease. And oftentimes that gets overlooked. We get so focused on what we're treating that we forget who we are treating.
Yes. Exactly that. I just feel like that's just one tiny little thing to shift from looking at a patient as their diagnosis or as their symptoms versus looking at them as a person, as a whole person who, in this case, has gone through cancer and who has been living with long-term symptoms. And I get that maybe a part of that is like wanting to provide some relief, and that's how they feel like they can provide relief. And I get that in a lot of situations, maybe their hands are tied. But in this situation, I feel like it's hard because as the patient, I'm having to push back. And that's way outside of the comfort zone that I had prior to getting diagnosed with cancer.
That's the thing. You're being put in the position where you have to react that way.
Yeah.
And that's an important distinction.
Yeah. And I think that I'm having to shift my perspective to be like, okay, I'm advocating for myself. I'm advocating for the answers that I need. And I'm not just being an anxious, non-compliant patient, because I think those are things that get slapped on us, especially as female presenting patients in the medical world. You know, it's like they want to point everything back to anxiety, especially for cancer survivors. Oh, she's just anxious. No, I want to understand what we're trying to do.
Or you may very well be anxious, but it's not just anxiety.
Yeah.
It's, yes, anxiety, but along with lack of information, maybe. You know, and you're not pushing back and saying, no, I'm refusing to take this medication. You're pushing back because you want to know more information before you make a decision.
Yes, exactly.
And
like
that's well within your right.
That's how I feel. I'm not being difficult. I'm trying to be responsible.
Yeah, you're trying to advocate for yourself. Bottom line.
Yes.
Bottom line.
Yes.
Because you want answers.
Yes. And
You're
so
not being difficult.
Yes. In the past, as a patient who has had complex issues with not a whole lot of direction, I would have seen the script for the med, looked it up, and then been like, well, guess I'm not going back to that doctor. And just completely ghosted the doctor, not went back for my follow-ups, and just moved on with my life, figured out how to manage symptoms on my own, whatever that looked like in the situation. But because I've been through cancer, because I have this pesky little bugger living in my stomach now, I can't just not go back. So I feel like I've devised a plan that I feel comfortable with because I need more answers. And so instead of just hopping on this medication that I don't have a whole lot of direction as to what he was thinking and how long he would want me to be on this medication and why he is prescribing it, what is it exactly that we're targeting, I'm going to call and I'm going to request an appointment with the PA who I've seen before, because unfortunately this doctor is only in the office 2 days a week because he's doing procedures the other 3 days of the week. He is extremely busy. Obviously, with him being so far behind in his appointments, like he's in and out, in and out, in and out, in and out the whole time. He doesn't have time to answer my questions. Let's just put it that way. So I'm going to make an appointment with the PA and I'm going to ask her my questions.
But that's huge because the old you would have said bye. You would have left without taking the med, without figuring out if that med would potentially work, without getting any answers, period. But no, you said, this isn't right. And now you are thinking, you know what? Let me get more answers. Let me make an appointment.
Yes.
So we can get to the bottom of this.
Yes.
That's huge. And I just want to point that out.
Thank you.
Okay.
Because it feels huge. Because it feels like I have been pushing so hard for myself and for answers and for a better quality of life and just navigating all of the everything. And it's a lot and it's heavy. And sometimes I just don't want to do it anymore. But this is showing me that by persisting and advocating for myself, that it does pay off because there is growth in that persistent self-advocacy. And I feel like as patients, whether we're living with chronic illness or whether we've had cancer, sometimes we're put in these situations where we need to ask questions. And it's okay to ask those questions without feeling like you have to apologize.
Absolutely. I mean, if we think about it, what are some things that we could say? How can we phrase a question so that we can get the answers that we want? Maybe we could say something like, can you explain to me your reasoning?
Yes.
Like, where's your brain going?
Yes.
Because, once again, we didn't go to the medical school. We don't have the knowledge that doctor possesses. So where's your train of thought going?
Exactly that, because I feel like sometimes the doctors, they're doing this all the time, every day, all day. It's like they expect us to know why they're prescribing this thing without explaining it to us. I'm not a doctor.
Yeah. Like, just break it down. What are we looking at? What do you think we're looking at if you don't know what we're looking at? What are we trying to rule out? What does improvement look like? And I feel the most important question to ask is, where do we go from here if this is unsuccessful?
Yes, exactly.
Like, what is our plan?
Yes.
Not, okay, once we know this doesn't work, now let's put our heads together and figure it out. No, let's think ahead.
Yes.
Let's be proactive.
Yes.
And if this doesn't work, then what are our options?
Yeah.
Let's brainstorm here, you know?
Yes, absolutely. And I think that those are questions that I will definitely put in the show notes, because I feel like that's priceless information to take in with you to an appointment when you're faced with a prescription handed at you to treat something and you're not sure why. You're not sure what you're treating. You're not sure what it's going to do, but you want to know. And you're like me, and maybe you need more information before you consent to doing something. And so we'll be sure to put those in the show notes, because I think that that can really help take some of the pressure off.
Definitely. I hope, my biggest hope is that this helps someone just exhale and relax just a little bit and know that you're not unreasonable for asking for clarity. You're not asking for a lot.
Yeah.
This is what you deserve. This is information that you as a patient deserve.
Absolutely. Absolutely. We're literally just asking for basic information about our own health, and we do deserve that. We absolutely deserve that.
If something in this episode, anything stuck out about your own health, anything you're navigating right now, you're not alone.
Yeah. You're definitely not alone. We're here to support you through the messiness of advocating for yourself. We also want to let you know that next week is Christmas. It'll be Christmas Eve on the day that we usually drop an episode. So we've decided that we're going to take a little break just for the week of Christmas, but we will be back on New Year's Eve with a year wrap, and we look forward to seeing you then. We hope you have a great holiday.
Thanks for joining us on More Than a Diagnosis. We hope today's conversation left you feeling seen, heard, and maybe even a little more connected.
If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who might need it.
And if you're looking for a place to connect with others who truly get it, join our support circle at morethanadiagnosis.org, where we will continue this conversation. It's free, it's welcoming, and it's built for you.
Because no one should have to navigate this alone.
Until next time,
keep living, keep growing, and remember,
you are more than a diagnosis.